do you have any questions for us?
Yeah, I actually have just a general question about occupational therapy. So, where do you usually get jobs? When you do you sometimes work for companies? I guess you are the occupational therapist that that employees see, or do you usually work at a hospital or facility, and then when it's related to person's job, then you guys get called in? How does it work?
Do you want to go?
I mean, well, for occupational therapy, the good thing about our profession is that we can work pretty much anywhere.
Mm-hmm.
So it's just based on, we can actually work in hospitals, we can open up our own clinics, we can work in schools, jail, or pretty much anywhere where there's a need for occupational therapy, or people need to get back to their activities of daily living or anything they find meaningful. So if there's a service or there's an activity or an occupation that they can't engage in or perform in, then that's where we go in and help them out. So it can be even what...
Yeah, that's one thing I like about though. It's
really
so broad. It's so many different disciplines.
Yeah.
And different...
Yeah,
all together,
totally.
converging into one. Yeah, it's pretty cool. It seems it's a very cool field. And it seems more a very human. I mean, when you think of medical industry, it seems it all should be human centered.
Yeah, that's medical model right there. That's something that we partly have to associate with, because if we don't, then we're not seen in the medical community as relevant.
Mm-hmm.
So we kind of have to go into that little realm of, okay, this is a patient, you have to see the patient. But at the same time, occupational therapists like to see the person as the person, not the person in room 24 in bed A.
Or just with an arm.
Yeah, that's
injury.
Right. Yeah, you're seeing the person as, because all the questions you're asking me, I feel most, if you go to the doctor, they're not gonna care about things. Like you said, they're gonna be you're the person that has this broken arm, that's what I need to fix, and then
that's what they need.
Yeah, right. When some other aspect of someone's culture, it could have a lot to do with not only the problem, but how they would then
how we would approach
how approach
working with you,
right? And how because some, depending on what your culture is, you might not want to do certain things that the person is suggesting. So